greatest reward I could have had. People react to this shop with similar amusement around the world. It touches a real universal note. The film is available in at least 30 languages, probably considerably more, and has been broadcast on at least 100 television channels in almost every country in sub-Saharan Africa and others far beyond, and this was a total surprise to us. In Fiji, Cyprus, Sri Lanka, Haiti, for example. A colleague from Senegal overheard a conversation outside a shop in a poor district of the Madagascan capital, Antananarivo. A young man had just bought biscuits, and his friend was teasing him, saying that he knew he had really been trying to buy condoms. They were joking about Olga's film. Olga's film, The Shop, was directed by fellow Burkinabe Idrissa Ouedraogo, whose latest feature film had been in contention for the Palme d'Or, the big prize at the Cannes Film Festival that year. Olga had the pleasure of acting as his on-set advisor for The Shop. Having grown up in Ouagadougou, the capital of African cinema, she dreamt of becoming a film director herself. In January 2004, her ambition was realized, and she co-directed 2 Scenarios films, allowing the voices of other young Africans to be heard across the continent. Between 1997, when Olga thought up the idea for The Shop, and last November, over 105,000 young people from 37 African countries participated in 4 Scenarios from Africa contests. A 5th contest was launched on World AIDS Day, December the 1st last year, just a few weeks ago, and we expect tens of thousands more scenarios to flood into the offices of our partner organizations over the coming months. It's an exciting moment. Since the first contest in 1997, an average of 3 films per year have been produced. The films are not only broadcast on television, they're also used as a discussion tool at community level in multiple African languages, and you're going to see this in a moment. The films are very effective at stimulating dialogue, allowing others to give voice to their problems, concerns, and solutions. As for Olga, well, she has attended international film festivals, sat on juries to select winning Scenarios scripts, featured in Scenarios films herself, adapted the films for use on radio, and coordinated a highly successful national Scenarios contest in Burkina Faso, encouraging a whole new generation of young Africans to follow her lead. So having outlined the process a little bit through Olga's story, I'd like to go into greater detail about some of the components of the process, and also to share more films with you. There are a couple of themes that will recur, but I don't really have time to go into them in a great deal of depth. The theme of community capacity. You'll hear me talk a lot about this as being a process rather than a project, because one of our goals is to help local communities develop their own capacity to address this epidemic, rather than to offer any pre-made solutions. Obviously, could not happen. Another key aspiration is to allow young people and others most affected by the epidemic to catalyze social and cultural change themselves. So as I said, I'm not going to go into a great deal of detail because I imagine that you'd be much more interested in seeing more films rather than hearing me speak. Couple of pictures. This is Olga with Idrissa Ouedraogo, the very famous African director, and her on the set of her own film. Here again, directing her own actors in one of her films. So, pretty evident that Scenarios from Africa is a community mobilization, education, and media process involving hundreds of partners, and this is very important. It's always rather embarrassing to be introduced at an event like this because the focus is on the speaker rather than on the amazing team that is really doing the hard work and making this happen. So I'd like to emphasize again and again that my husband and I, who coordinate the process, are doing a very small job compared to the local partners. So it's carried out with and for young people. Originally it was just in 3 countries in Africa. And in a couple of conversations today, people have asked me, well, how did it grow? And that's the amazing thing. It just grew. You know, it's very difficult to explain how it grew. It grew in ways that we never anticipated. The first 3 films, like The Shop, were originally intended just for those 3 countries. They were intended for that cultural audience. And before we knew it, they were being shown daily in Lesotho, at the other end of the continent. They'd been dubbed into 6 languages in Namibia, again at the other end of the continent. So it really just, they just grew. So we've been running since 1997 with funding from a range of sources. Our primary funding has come from a wonderful organization called Comic Relief in the UK. We drew inspiration from a French project run by a wonderful partner of ours named Crips, based in Paris. And as you know, it involves the production of short films about HIV by leading African directors. But what makes those films so special is the fact, of course, that they're based on ideas by young people. So between 1997 and 2005, there were 4 contests inviting young people to come up with ideas for these films, implemented by over 1,000 local organizations. As we've already indicated, a great, fantastic participation that far exceeded all our expectations. And something that was particularly gratifying to us was the fact that around half of all the participants took part in a mixed gender group. In other words, young men, young women, adolescent men and women coming together to talk about issues around HIV, situations in which HIV can be an issue together. And that's very, very important. That's a key element of this entire process, is that dialogue that takes place. The contest, we know, has been tremendously successful at increasing dialogue and reflection, increasing information seeking by those young people, increasing awareness and use of services. So we have some great data on increases in use of voluntary counseling and testing services, for example, through the course of a contest and also beyond. And increasing cognitive rehearsal, allowing young people to imagine themselves in situations that they may someday encounter, and through that imagination, through that creative activity, prepare themselves for that situation that they may someday face and develop skills that they're going to need in those situations. Also use their imaginations to imagine a different world, different people that they could be. I think that when we talk about public health, we tend to think of it as a relatively dry subject matter to some extent, and we exclude some of these creative, imaginative dimensions that are so central to our lives, so central to our humanity, to what makes us tick and motivates us. And I think it's very important that this process allows young people to tap into that resource, that depth of humanity. So I wanted to share with you one example of a scenario. What astounded me the first year when we saw these scripts coming in was the level of time and energy and care that young people had invested in participating in this contest. And this is just one example of a 21-year-old from the Democratic Republic of Congo. But equally, the ones by 9-year-olds, for example, on little scraps of paper, are equally touching, as I'm sure you can imagine. These are some winners. We make a big deal of the prize ceremony, because it's very important that these young people see themselves as agents of social change and are seen by their communities as such. These are young winners on the island of Sal in Cape Verde. And I couldn't resist including this one, although it's not a great photo. This is One Great One Graua from Burkina Faso. He is our youngest ever national contest winner, 9 years old. So just to give you a sense of how the process has evolved from 1997 and 2000, when it only took place in 3 countries, to 2005 and now 2007 and 8, where it covers a lot of sub-Saharan Africa. So the winning ideas are selected by a succession of juries, first at a national, then at an international level. And the juries are made up of former contest winners and other young people. This is actually Olga that you can see in the bottom corner. And alongside her is a gentleman called Cheko Masisoko, who is a very well-known African filmmaker, and also until about a month or so ago, he was Minister of Culture of Mali. And he has used his ministerial position and authority to do wonderful things for the scenarios process. It's fantastic to have an advocate at such a high level. So people living with HIV and other specialists in HIV prevention, treatment and care sit alongside those young people, as do fantastic filmmakers like Cheko Masisoko and other specialists in communication. And as you can imagine, this whole process, because you're bringing people together from very different domains, is incredibly rich. Everybody has so much to learn from one another, the public health specialists from the communication specialists from the young people. One thing I should mention is that each script is read by at least 2 people, and it's a very rich dialogue-based selection process. So the films are between 1 and 14 minutes long. An average of 3 have been produced per year. They cover a range of subjects, and you saw one of the very first films. The Shop was one of the very first films in the Scenarios from Africa process. These are some of the most recent films, really just released in the last few weeks in the run-up to this next contest. This is a fascinating one. It's called Looking for a Brave Man.